drilling. I'm excited and extremely nervous.
Why are you nervous?
I'm nervous because the kids are going to outnumber me and my wife.
We are due for a third at the end of June, and I have 2 girls already, and this is also a girl. I think what makes this pregnancy so unique is the very end, so the last trimester basically has been spent in quarantine, and it's made things really different. I think with this one in particular, we wanted to do a lot with the 2 kids when we're not outnumbered. Usually we go and we have routine visits with the OB himself, but this time our doctors are kind of off limits and they're reserving them only for inpatient deliveries and other emergencies, and then we're being seen by a nurse practitioner.
I'm done with my dad.
The whole labor and delivery process, they've already informed me, is going to be very different. So right off the bat, they said, I can only have one person of my choice in the delivery room, and whoever that person is has to stay there the entire time. So if they exit the room, they're not allowed back in, and then I'm on my own.
I'm concerned that I may not, if I have to leave for any reason. I take care of a lot of cancer patients right now, and it's really unfortunate. I just have to do FaceTime visits with my patient families so they could see their loved ones right after surgery. So I don't want to be doing that. I'm hoping I don't have to do that with my new baby.
In my previous pregnancies, I've had, my mom, my husband, they swap or they're both there. It's very different than just having one person. And then of course I worry who's going to take care of my kids at home. That person usually has to be interchangeable with my husband. So that's different. And then they also told us every patient that comes in labor, they're going to test for the coronavirus. So this is something that scares me a little bit because, you can be an asymptomatic carrier. So if you test positive, they're going to strongly recommend that you separate from your baby that you're delivering for 2 weeks. I mean, that just sounds extremely traumatic. They'll make that recommendation, and then obviously it's up to the patient to decide what they're going to do. So you'll have to outweigh the risks.
It doesn't matter if there's a pandemic, babies will still be born. What's different, I think, is probably a little bit more kind of emotional in how we approach it, because there is, an element of anxiety among healthcare providers. We don't know if the patient we're treating is COVID positive or not. If they come in in full-blown labor and we deliver them, we may not know that they're COVID positive until after their delivery and after we've been exposed to the patients. Social distancing patient to provider is very difficult because of that. And it's a hands-on field, and we have to be close to our patients. We blocked off rooms that are considered negative pressure rooms. So if someone is actively COVID positive, they have to be in a specific room. So we had to kind of work with our resources, where you place your nurses, where you place your doctors, all of that kind of changes too, to ensure that we're reducing cross-contamination. Specifically with the pandemic, there has been this concern of, should I have a home birth instead of going to a hospital? And that's one of the things that we've really had to advocate hard and say, the risks of a home birth outweigh the risk of you getting COVID in the hospital.
For the most part, I think we're not only worried about the coronavirus, just in general, the first month of the baby's life, their immunity is very, very weak, and whatever the virus is, whether it's during flu season, now it's during COVID-19 season, I mean, we have to be very, very careful. We don't want our baby exposed and, God forbid, developing a fever, because that workup in of itself in the hospital is such a nightmare. We don't have any research, any updated research with regards to, fetal risk of getting infected with the virus and what it means in utero and what it means postpartum. We really don't know. We're just doing a lot of, guessing, and then things can change based on recommendations from ACOG and other, the infectious disease organizations as well. So who knows what's going to happen. Even in a month, they might say something different.